Do you give consent to be videotaped for this interview and have it posted on YouTube?
I do.
All right, thank you. All right, so my name's Nancy and I'm your provider, and I'm going to ask you, I'm going to interview you to get some medical history and find out a little bit more about you so I can better take care of you, okay?
Sounds great.
All right. All right, so can you please tell me your name?
Abby Smith, Abbie Smith,
Okay, and your age?
64,
Okay, and your ethnicity?
white,
Okay,
Caucasian.
okay. All right, and your date of birth, please?
February 28th, 1955.
Okay. Okay, so today's going to be your yearly checkup, so I'll be asking a lot of questions, but do you happen to have any chief complaint at this time?
I've been suffering from sinus stuff for like the past 3 weeks, and it's clear. There's some times where it just dribbles down my face. And at night from time to time, my ear aches.
Okay.
And it's been happening at the same time.
Okay, okay, so last 3 weeks, what have you been taking to help you with these symptoms?
Well, I don't like to take pills. So, and because it's not green, I don't really want to take anything. I advocate, homeopathic stuff. So, what made the ear pain go away was putting drops of aloe vera from my plant that I have at home, and doing the same thing with the Q-tip in my nose. But that's kind of like the Band-Aid effect. That'll help with the symptoms, but I'd like to know what's going on.
Right, because you've had it for 3 weeks. Okay.
So I don't think I have anything bacterial, which is always my main concern. So that's why I'm just bringing this up, because it's our normal yearly whatever it is. But if I wasn't here for my annual physical, I don't think I would even come to you, because my biggest concern is having something that's a virus turning into bacterial. But if it doesn't and there's no green,
Right.
I'm not worried about it.
Okay, so when you use the aloe vera drops in your ear and then you use it as Q-tip, what kind of relief did you get?
It wasn't as inflamed, and it stopped dripping, and the pain went away in my ear.
How long did that last? Like, let's say you did it and then did it come
Overnight.
back? Oh, so it worked
24 to 48 hours.
You got relief for that length of time?
Yes.
Well, that's pretty impressive.
Yeah,
Okay.
it is.
Okay. All right, so what about you say nothing over the counter?
No, Bucinix and stuff like that doesn't really work for me, and I don't like taking stuff that would dry up my nose, because then I get a dry mouth, and as long as it's not super stuffy and the aloe works, I don't sleep with my mouth open, so that's great. So I try not to introduce anything that's going to make any part of anything worse.
Right, that makes sense. So basically, from what I understand you're saying, is that this aloe vera that you used gives you symptomatic effects for about 24 hours, and then you redo it again if you need it.
Yes.
And so this has kind of been going on for 3 weeks.
Yeah.
Yeah. Has it gotten in the 3 weeks from when it started, has it gotten worse, or has it gotten better, or just stayed the same?
Well, it started and then it got worse. And I really have minimal allergies. Like, I have allergies to sulfa because of some drugs, antibiotics that I took that had sulfa in it. And so I've never really had allergies like to grass or trees or flowers or anything along those lines. But my husband is highly allergic. So when I go through that, I say, "How are you doing today?" And if he's not having any real big issues, then I know it's probably not allergies per se. So it got worse a couple of times. One was when allergy and pollen was high, and one when allergy and pollen was not. So right now, there's nothing dripping. So that's a good thing. And yesterday, I used aloe, not today. So it says necessary.
Okay, so you feel like if that's the only treatment you got, that you would eventually get past this?
Yeah, I would say I wouldn't say it's seasonal, because it happens like twice a year, but it's at different times, because I've kept logs over the past couple of years.
Okay.
Yeah.
So you feel fully satisfied that what you're doing now is all you want to really do?
Yes.
Okay. All right. Okay, so we talked about when it started. We talked about that it's the earache and it's the runny nose. And basically it's you just don't, it's irritating, to keep wiping and stuff like that. But has it the pain, let's say the earache, on a scale of 1 to 10, what would you say the pain in your ear was at the highest, when it was the worst?
8.
Okay, 8 out of 10. And then, and the runny nose really, of course, didn't cause you pain. It was just annoying then.
Well, and it was runny. I mean, we're talking about, as I'm talking to people, it's dribbling down my face.
Mm-hmm.
It didn't matter how much I blew my nose.
Mm-hmm.
And then I would use the aloe, and it wouldn't run anymore. It was just stuffy, and then it would clear up for a little bit.
Okay. All right, so when you took the aloe for your earache, and you were 8 out of 10, how low did it get when it was, how effective was it in essence?
Oh, within 20 minutes, the pain went from 8 to like 2 or 3.
Okay, and that's okay. That's a good level for you to deal with it.
Yeah, and then by the next day, it went away. And I think I had to do it 2 or 3 days in a row, and then it was gone.
Okay. Is there anything that made any of these symptoms worse or better?
The aloe made it better.
The aloe made it
I don't know
better.
what made it worse. I don't know why.
Okay.
So, I used to live in a different part of Arizona where there were a huge amount of orange blossoms. And orange blossoms, when they were in full bloom, that happened to me. But I'm not anywhere near orange blossoms where I am now.
So it's kind of a bit of a mystery then.
Yes, it is.
Okay. All right, let's go ahead and move on. We're going to talk about your past medical history. Can you tell me a little bit about your, any diagnoses that you've had about your health?
I have gingivitis and I had gum surgery 2 years ago. That
Okay.
was very helpful. I didn't lose any teeth. It was very successful.
Mm-hmm.
I have a knee injury where I fell down the stairs and I severely sprained all of the tendons and fascia in front of my knee and down near my ankle.
Is that your left?
Yeah, my left.
Okay, left.
And I've been recovering from that.
So left knee and ankle. And when did this happen?
6 years ago.
6 years ago. So that was about 2013. And the gingivitis, when did you get it last treated?
I go on a regular basis.
But the actual diagnosis has been resolved. So when you did have
It's
it,
never resolved. You continue to have gingivitis,
Okay.
but the possibility of losing the teeth was resolved 2 years ago.
okay. So it's
But I get a cleaning every 2 months and a checkup by the periodontist every 6 months, and he's incredibly happy.
oh, good. That's good news. All right. Anything else?
Nope, because all I take now is vitamins. I use CBD cream on my knee for severe pain. And occasionally when it gets really tight, like we went on a cruise last summer, I would take a quarter of a Flexeril when it was extremely tight and I couldn't work that part out. And then if I'm in severe pain, like one of my grandkids actually jumped on the knee and started punching it, I would take a half of Vicodin. So those are only in extreme circumstances, the Flexeril and the Vicodin.
Mm-hmm.
And I only use them as I need them.
Okay. So there isn't any other diagnoses, nothing with lungs or cardiovascular or anything like that. Okay.
Nope, I did. I went to my yearly physical with another doctor. That's why we're doing this interview. I moved back to Tucson and I did my pelvic exam, my mammogram, my lipid profile. All those things were normal.
Okay.
Actually, what was interesting was I was taking ibuprofen on a regular basis
Mhm.
every day, 4 to 6 tablets, probably twice a day for pain on my knee, and my blood pressure was elevated. I wasn't taking anything else, and the
Mhm.
doctor's like, "You need to reduce the salt in your diet." And I'm like, "I don't salt my food.
Mhm.
I use Mrs. Dash. I use powder," and she's like, "No, you need to do this." And we couldn't get my blood pressure to lower. So personally, I don't like being on different meds. I was more on Vicodin. I got off that. I got into the ibuprofen. So I was cutting from 4 tablets every 6 hours or twice a day to 3. And then we saw a dip in my blood pressure, but we didn't realize that was the source. So I wasn't taking anything else. I wasn't salting my food. And so I said to her, "Do you think that it could be the ibuprofen?" She goes, "Yeah, it could be." So I looked it up and read articles and went cold turkey. My blood pressure went to normal in 2 weeks.
Wow. That's good information.
Yeah, it was very good. I was very happy because, I mean, she had me on blood pressure medication and it wasn't working. and it was making me dizzy. And then she was like, well, we should up it because your blood pressure. And I was like, no, wait, something's not right here. So
Okay. All right, let's talk about any surgeries you might have had. No surgeries?
gum surgery.
Okay, gum surgery. And that was, are you saying in 2017?
Yes.
Okay. How about hospitalizations where you've spent the night in the hospital? Great. All right. And
Never had a broken bone.
what month was it when you had the gingivitis? I know the year, but what month was it?
It was initially diagnosed 1992.
And it got repaired in 2000.
Well, we did root planings and cleanings, and we tried different things, and then it got to the point where we needed to have gum tissue cleaned up and sewed and tightened.
Okay, and that was in 2017.
Yes.
So this has been a bit of a journey, but a
Oh.
good ending. Okay, what about your immunizations? Are they up to date?
Yes.
Okay. If you would mind, next time you come in, if you could bring a record of it so we can have it in your chart, okay?
I have it with my passport because we had to make sure we had them before we went on the cruise to Europe.
Okay, all right, so you just bring them in, we'll update your chart. Let's go ahead and go over, you've already mentioned this a little bit, but I'm gonna just make sure I understand. Allergies to environment, anything that you know of,
I don't
ragweed,
know.
cactus, anything at all?
I don't know.
Okay, how about food allergies?
Yes, I do know about food allergies. All the things that I don't like that I stay away from, which are coffee, cranberries, blueberries, beets, and crab.
And those, you don't like them, or did you eat them and then you had a reaction to them?
No, didn't have a reaction. I've just never liked it. I've never liked the smell of coffee. I don't drink coffee.
So these are foods you stay away from, but you're not necessarily, for all practical purpose, allergic to them?
No, I am allergic to them because there was a point when I had the blood pressure issue where we did a blood test for food allergies, and that's what came up. And I
Okay,
said,
all right,
well,
good.
that's interesting. That's why I've never liked coffee. That's
Oh,
why
I see what you're saying. So basically, you didn't like them, but then you've had scientific proof that you were allergic to them with the allergy tests.
Yes.
Okay, I get you now. Okay, so I'll put that down. When was this allergy test taken? When did you do it?
2016.
2016. Okay, maybe we can get those records in our system as well. What about medications? Any kind of drugs, or whether it's over the counter or prescribed?
Only sulfa based.
Sulfa. Okay, sulfa. And what was your reaction to sulfa?
I was taking an antibiotic at one point. I had strep throat, and there was an antibiotic with sulfa. And I came back from the doctor, and they tell you to take 2 tablets to start, and then do whatever it was, which was 3 times a day. So I had 1 more to take in the evening. And after those 2, my temperature went up to 104.
Wow, so you elevated temperature,
Right.
104?
And that was it, but I felt so crappy. So I called up the doctor, and my husband was packing my armpits and my crotch with ice to bring down the temperature.
Right. That's good.
And we called the doctor, and she said, stop taking the antibiotics. Don't take any more. She said, if you can't get your temperature down, come into the ER. But we were able to get it down. And she tested me, and I was allergic to sulfa.
Okay, so you did get an allergy test for it. Besides your elevated temperature, did you experience a flush feeling, or did you get a rash anywhere, itchy, or anything like that?
I just felt so horrible. There was nothing in my... I had no regular allergic reaction.
No anaphylactic, like swelling
No.
of the throat or difficulty
No.
swallowing or anything
No.
like that? Okay, so just basically your body just increased its temperature to deal with it, I guess. Okay.
And then there was one other allopurinol. I can show you in my
Allopurinol?
Yes.
Okay.
No. That's
Lisinopril?
lisinopril. That's
Is it
it.
for blood pressure?
Yes.
Okay.
Lisinopril. I've got it in my phone, and I'll verify it with you. But lisinopril, they put me on that. That was the first drug they put me on for my high blood pressure, and my tongue did swell.
Okay, so tongue swelling. Anything else?
My throat swole.
Swelling, throat.
And I called my doctor, who this is back in Colorado, and he said, do you have any Benadryl on you? And I do, because my husband has serious allergies. He goes, take one now. He said, I want you to, if you can, smash it,
Yeah.
but have it under your tongue so that you can get, and it went down right away, and he said, stop taking the meds.
Okay, so lisinopril and sulfa products.
Yes.
Okay. got all the reaction you had to them. And when did this, like, when you had a reaction to sulfa, how long ago was that?
Sulfa was 1991.
Okay, and what about the lisinopril? When was that?
That was 2016.
2016. Okay, we'll make sure we put that in the chart. Okay, so currently, I know you've already mentioned a little bit about the medications you take for symptoms of sorts. Can we go over that one more time?
Yes.
I wanna-
So
what I
as
wanna ask-
needed, I'll take ibuprofen.
Okay, hold on. As needed, ibuprofen, got it?
Um,
Oh, before you go on, I need the dosage.
it
Per
varies.
tablet. What's
220
220
per tablet, and
220
I usually-
milligrams
yes.
per tablet, and then you take
I usually take 2 unless something's severe.
2 tabs at one time. Okay. And what type of symptoms do you take it for?
If I have inflammation in my knee and in the general area, if I have a pretty severe headache,
Headaches, okay. Alrighty, okay. Any other medications?
Vicodin is needed, a half a tablet.
Okay, what is the milligram per tablet?
I don't know. I'll have to.
Let's look, yeah, usually it's like 5, 10. But there, do you know Vicodin's
Oh,
got
it's
2
10.
drugs in it? Because there's hydromorphone and, or excuse me, hydrocodone and Tylenol, so it could be like 5, 325 or 10, 325?
It's 10, 325.
Okay, 10, 325, so that's the milligrams, and then you take that, again, probably for severe pain.
Severe pain.
And when was the last time you needed it for severe pain?
We're in September. We went to graduation of one of my grandchildren, and that one of my grandchildren punched the crap out of my
And
knee.
that was
May.
May, so that's May of this year. Okay, and you took a half tab, you say? So then, okay, so half of
Twice.
a
So I
ta-
took a half tab. 12 hours later, I took another half tab, and that was.
Okay, 12 hours. Okay, so 12, I'm glad you don't take it more than needed, because it's not really, good for you.
I
but
don't
you
like
need it,
to,
you
but
need it.
if I have severe pain,
Yeah, of course.
it's. And when I say severe, we're talking 9-10 area.
Right, so, so that's why you took it, because you had like a 9 out of 10 pain. And then the ibuprofen, what's your pain range when you go with the knee and when you have to do it for a headache?
Oh, ibuprofen is probably in the 5-6 range.
Okay, for those types of
Yes.
reasons, okay. Alrighty. Alright, so we've got 2 so far.
And then the last one is Flexeril.
Okay, flex, okay, milligrams.
I don't know what it is. It's just a small little tab, like
Okay.
very
We
small.
can look that up before we.
I break it up into quarters. It's incredibly
Okay,
difficult,
So,
but I never take more than a quarter at a time because it really knocks me out.
and you take it for what symptoms?
When I have been working out because I'm recovering from this injury, and like when we were at the cruise, I would walk quite a bit every single day. And by the 4th day, it was so tight that sitting in the jacuzzi or whatever would not give me any relief.
So muscle tightness.
Severe muscle tightness.
Okay, got it. And, okay, so you take a fourth, a half, whatever it is you feel
A
like you
quarter.
need.
No, I only take a quarter.
A quarter at a time. Okay, got it. Anything else you take over the counter, or any herbal or vitamins, things like that?
I take vitamins. I also use CBD cream, and I've also smoked marijuana for relief, and I've not smoked marijuana but taken the gummies at a very low dosage.
Okay, gummies. All right, so let's talk about the vitamins. Is it a multivitamin?
There's a multivitamin. There's a B50 vitamin.
B50.
I take magnesium, 400 milligrams. I
400.
take 2 calcium tablets, 400 milligrams each.
400.
With D. The D's already in there.
Okay, plus D.
I take 2 cinnamon tablets,
Okay.
and those are, I believe, 400 milligrams as well. And if needed, I take a 90 milligram potassium
And how do you know
if I get a Charlie horse.
Okay, for cramps. Have you ever had your electrolytes checked? Any blood draws?
Every year.
How is your potassium level during that?
It was
time?
normal.
Normal, so it's not, okay. Because if you're gonna use potassium as supplements, you gotta make sure you monitor your electrolytes just to make sure you're not going too high. Okay, so let's talk about the CBD cream. What, do you put it on your left knee and ankle?
Mhm.
Okay. And does it come in strength? I'm not as familiar with CBD
Yeah,
cream.
it's 660 milligrams of hemp CBD with less than 0.03 THC.
Less than 1
No, less than 0.03 THC.
point. Okay.
0.03. And that's the criteria so it can be sold over the counter
Of T what?
of THC.
THC. Okay.
THC is the hallucinatory part of marijuana.
For over the counter. Okay. Yeah, I need to look into that more because it's going to be coming up nowadays, right? Okay, and when so that's something you can get over the counter. What about the marijuana? Are you getting it through a dispensary?
Yes.
Okay. And is it already rolled, or is you saying you're using gummies?
When I had marijuana cigarettes, I would get them already rolled. But what happened was, I'm like a lightweight, so it was always too much marijuana. Like I could take one hit, and I would be enough to relax everything. It's like it was in exchange for the Flexeril when everything got really tight, because it doesn't make you tired. So Flexeril kind of knocks me out. So when things are really tight, I would go ahead and take a couple hits. So I would buy one of their regular cigarettes, and you can buy different kinds. And I would tell them pretty much what I wanted potency, and I have a hypersensitive taste, so like what I wanted it to taste like. I know that sounds weird, but they have different tastes. And so I would get one marijuana cigarette. I got my marijuana card quite a while back when I first moved here, and I'll go get one marijuana cigarette, and I've only used 3 since 2016. Because
3 cigarettes?
yeah, total. Because I only use them as I need them for the tightness in my knee and my quads and.
And how often would you say, let's say in a month, in a month duration, how often do you need to use it?
Once or twice.
So once or twice a month. Okay. And it works. It works for you.
Yeah.
Okay.
I have a concern about my lungs though, so even though I didn't utilize it like a lot of people do, I just didn't even want that impact on my lungs.
Okay.
So I've gone to, and I don't even know what the milligrams were. I could get checked for you, but I said I want this equivalent to 2 hits of this cigarette.
Okay, they figured it out for you. So now
Yeah.
you're using gummies only.
Yes.
Okay. All righty. That's good. I mean, it's better than, like you said, the smoking part.
Well, and I think it's better than the Flexeril too, because I can continue to function. You know, I have a pretty busy life.
Okay, well, I'll be putting all of this in your chart, and then we'll go over it again once it's in there, just to make sure that I got everything exactly the way you said it, okay?
Okay.
All right, let's talk about your family history. We're talking about immediate family, like brothers and sisters and parents and grandparents on both sides. So can you tell me a little bit about any illnesses in the family?
My dad, my paternal grandmother had heart disease and died of a massive heart attack. Her husband had Parkinson's.
So your paternal grandfather,
Right.
okay, he had Parkinson's, got it.
But he still lived 12 years after he was diagnosed, and he was very rigorous with what they asked him to do, and he was one of the pioneers of L-Dopa before it became
nice.
de rigueur. Yeah.
Okay.
On my mother's side, maternal grandparents, her father had late onset diabetes, came on when he's 90. I think it had to do with what he ate between you and I.
Okay.
But
It's like pancreas was like, I'm done. It's okay now.
Well, I don't think he had much sweetness in his life either. Dementia.
This is the same person, right?
Uh-huh.
Okay.
And then his wife,
Okay, so let me just categorize this a bit. Maternal grandmother. Okay, got it.
had a heart attack when she was 92, and then also had dementia the last 3 years of her life, and she died at 98.
Wow. You have longevity in your family.
I do. My maternal grandmother, her siblings lived from 92 to 104. Yeah.
All right. Okay. So just to go over it again real quick, paternal grandmother, heart attack, died. She had heart disease, but died of a heart attack. Paternal grandfather had Parkinson's, and he died at what age? 90, you said?
No, paternal. He 83.
Paternal, 83, okay, 83. And then maternal grandfather, late onset of diabetes, died at 90, but he also had dementia. And then maternal,
No, he died at 98 as well.
98. And then he had dementia. And then the maternal grandmother died of a heart attack.
Well, she had a heart attack,
Okay, she had a heart attack.
and then she had dementia,
Uh-huh.
and then she died when she was 98 as well.
Okay, so, all right, I got the ages
She didn't
mixed
have
up.
any other problems with her heart after she had that heart attack.
Oh, that's good. She still lived. Okay, what about your immediate family?
Oh, my mother, she's had back surgery,
From an injury or?
yeah, and she had been in a car wreck when she was like 21 before she had us. And so she's had shoulder and back surgery, and then she's had her knees replaced, both of them, and one of them a second time, just recently.
But no other?
Nope.
Okay. What about your dad?
My dad had prostate cancer and had that removed, and he has a pacemaker.
What is the pacemaker for?
He had been an athlete his whole life, and his heart became enlarged and was so slow that
He'd get
lightheaded.
His heart rate would go down too low. So this pacemaker is to, if it goes down a certain level, it kicks in. Okay, gotcha, for bradycardia.
And he used to have high blood pressure, and he's taking care of that. I don't know how, but he doesn't have to take his medicine anymore.
Okay.
And my mom is hypoglycemic.
Okay, so she's not a diabetic?
Mm-mm.
Her blood pressure just drops. I mean, her blood sugar just drops.
From time to time.
Okay. And any brothers or sisters with any diseases or illnesses? Okay. That's good. Now we're going to go on to some other topics. Okay. We did talk a little bit about the marijuana. Do you use alcohol? Do you drink alcohol?
I drink maybe once a month.
So, socially? Once a month. And what do you choose to drink?
Mike's Hard Lemonade or a margarita.
Okay. Okay.
Or Spumante for special occasions.
Okay. And when you do drink, how many drinks do you have at one time?
2.
2 drinks at a time. Okay. About once a month. Okay. Do you use any tobacco products, whether it's chew or whether it's smoking or pipe or anything like that? Okay. And then we did talk about the marijuana and the CBD cream. Anything else? Any other illicit? Well, that's not illicit, but any other drugs that are illicit? Okay. What about caffeine? Do you consume caffeine?
I used to drink Diet Coke like people drink coffee during the day, but I'm down to either no Diet Coke or 1 Diet Coke a day.
And how many ounces are in one container?
16 ounces.
So 16 ounces of Diet Coke daily, not all the time, but if you're going to drink it, it's just the one time. Are you using any other sources of caffeine, like green tea or coffee? Well, you said you don't like coffee.
The tea that I drink is yerba mate, and it doesn't have caffeine. It has matine, which does not make you jittery, but it's still a cannabinoid. Sorry, not cannabinoid, an alkaloid.